Hi there, my name is Dean Burns. I'm just going to be talking to this sedation procedure. We're just going to make sure we've got our bag valve mask and airway trolley ready, which is over here in my eye line in case we need it. We've checked our oxygen flow meter, and we've got our suction checked and pre-prepared to make sure it's functioning. We've got some IV fluids here at the bedside just to ensure that the cannula is patent and useful. And as well as my sedation drugs, I've got some rescue drugs, which are typically medications like metaraminol and possibly adrenaline at a mix of 10 mics per mil for the patient's hypotension. I've also connected some capnography, CO2 monitoring here. We can see the pump started, and we've got waveform end-tidal CO2 connected to the patient's nose. I just want to make sure before we check we've got the patient on telemetry. We've got the pulse oximeter connected, and we've got a non-invasive blood pressure cuff which is cycling every 2 minutes. So Charlotte, would you mind checking that for me, please?
Yeah, so I'm going to set it up to do every 2 minutes. So I click on the blood pressure, click on cycle time, scroll up to 2 minutes. Oh. Click on 2 minutes and then press stop and then start again and then close it. And it will start cycling every 2 minutes.
So once we've done our pre-procedural set of observations, we'll document those, and then we'll make a note of the time and do a final stop check to make sure that we're doing it the appropriate side and everybody's ready and happy to proceed and nobody's got any concerns at this point. Once we've done that, I'll make sure that we've checked the doses of the medications. We've got a 60 kilo patient here, so typically I'd be using about 1.5 mics per kilo of fentanyl. So in this patient, maybe around a 90 mic dose of fentanyl, which I'll give a couple of minutes before the procedure to ensure the patient's comfortable. Following that, I'll typically dose propofol at 1% propofol at around 20 to 30 milligrams every few minutes, while carefully watching the patient and engaging them in conversation to ensure that the patient is properly sedated before we begin the procedure. So I've got my medications here. I'll draw up my fentanyl and give it a push. And after several minutes, we know sometimes the patient can get an itchy nose from the histamine release, so we'll know that that's the case. And then 1% propofol is given in 2 to 3 ml aliquots until the patient is exhibiting drowsiness and sleepiness and relaxation. I'll speak to the patient verbally in a loud voice and maybe check an eyelash reflex to ensure the patient's adequately sedated before we begin the painful procedure.
Once the propofol is in, can I come in and then do the procedure?
If you just hold on 1 second till I check that my patient's fully asleep before we begin the procedure. Okay, Zoe, are you still with us? So Zoe is asleep now, and now we can begin the procedure safely.
Dr. Burns, I think there is a phone call. Do you want to take that call?
If we can just ensure someone's available to take that call, please. I have to be dedicated to looking after this patient's airway.
Back in.
Is that back in?
Yeah.
Okay. So we'll just need a collar and cuff sling for this shoulder.
Yeah, I'll grab
And
one.
once you're ready, if you just request a post-procedural reduction x-ray of the shoulder, and I'll stay at the bedside until the patient's recovered from this sedation.
Four minutes up. Patient recovering.
Yeah. Zoe, are you okay? Just waking up from your sedation now. It all went well. The shoulder's been reduced, and we're just going to get you an x-ray once you're fully awake. Can we just have a repeat set of obs, please, on the patient?
I'll just start the blood pressure again. And then I'll print out the trends for the last 5 minutes.
Thank you.
So I'd click on trends and press print page. and it will come out of the printer at the next.
Yeah, and I'll remain here until the patient's fully recovered and won't be seeing any more cases.
Mhm.